My name is Benjamin. I'm a nurse here at the Sex Clinic. Could you tell me your first and last name?
My name is Christian Scaffold.
Kristen Scaffold. Okay. Kristen, could you tell me your age?
16.
16. All right. What brings you into the clinic today?
About a week ago, I had a little lower abdomen discomfort, a discharge, and really I've been super anxious about it all week. I've been staying up late. It's been affecting me at school. I'm really stressed about it. I've been searching up my symptoms, but every time I searched up, it just kind of sends me down a bad rabbit hole of information. So when I talked to my mom, she said it was best if I come in here today.
It absolutely is best. I agree with you. Some of these online forms of education aren't always the most trustworthy, so we always recommend coming into the clinic and receiving at least some truth. All right. So why don't you tell me a little bit about yourself? Like, you go to school, I assume?
Yes, yeah, I'm in school right now. I work part-time. I love hanging out with my friends. I play basketball. I run track.
Oh, wow, okay.
I have a new boyfriend. We've been seeing each other for about 3 months.
Okay, how's that going?
It's going well so far.
It's going well? Good. Are you sexually active?
Just started to be, yes.
Okay. And do you guys use protection at all?
We use condoms when we have them, but sometimes we don't, so we use the pull-out method.
The pull-out method, okay, all right. And could you tell me approximately when was your last period?
About a week ago or so.
Okay, a week ago?
I think. I'm not really sure.
And is that normal for your cycle?
Yeah.
Okay, all right. Okay, Kristen, well, I want to go over just a couple of important details here with a health teaching activity for sexual and reproductive health. Is that all right?
No, that sounds great.
All right, let's get to it. So I'll give you this, and that's just a brochure and kind of a guide that goes through different topics. So we'll open it up, okay? So if you look to the overview, we're going to go over just four key topics today, okay?
Okay.
So that's the importance of protection,
Okay.
understanding contraceptives,
Okay.
risks of unprotected sex, and then seeking help and support. And then after we'll do like a little teach back activity just to make sure we got everything.
Okay.
Okay? So let's move on to our first goal here. All right? Importance of protection. So do you know a lot about protection?
Just, the condoms are, they help, and I know some of my girlfriends are on birth control.
Right. Yeah, absolutely they help. So they help a lot of things. So condoms can help against STIs and STDs, but also unplanned pregnancies. Pregnancies can kind of interrupt our lifestyle and what we do every day. So things like high school, part-time job, basketball, track, those are all things that could be interrupted by an unplanned pregnancy. So do you know kind of what the devices are that you can use?
Like I said, we use condoms, and really the only other one I kind of know about is the talk with some of my girlfriends about the birth control they're on, but that's about it.
Absolutely. So there's tons of birth control too, but some of the other protections, there's female condoms, and then like you said, male condoms. There's also IUDs, and then yes, birth control, which an IUD is a form of birth control. Do you have any questions about those?
I've never really heard of a female condom.
So a female condom is sort of like a male condom, except it's for a female. So instead of putting it on a penis, you would insert it into the vagina before sex.
Oh, okay.
Okay? And that just protects the girl from any type of STIs, STDs, and then, when the male ejaculates, then it would protect against unplanned pregnancies.
Oh, okay.
Okay? And something that's really important to know is that you can get some of these safe sex supplies from your local health clinic. So
Okay.
even here, we provide things like condoms. So you mentioned with your boyfriend that you don't always have access to condoms. Anytime that comes up, you can always come to your local health clinic and grab a few.
Okay.
Okay? So is there any other questions before we move on?
No, that sounds pretty straightforward.
Sounds straightforward? Okay. So we'll move on to risk of unprotected sex. Could you tell me a little bit about what you know already?
Well, I know when you have unprotected sex, sometimes you can get pregnant, and that's, really all. I know there are some things out there, but
No, that's really good.
I'm monogamous with my boyfriend, so.
Okay, well that's also great. And you said you don't know the history of your boyfriend?
No, we never really talked about it.
Okay, so something that's really important to note is that STIs and STDs like gonorrhea and chlamydia usually are undetectable, so the person doesn't really know that they're suffering from this disease. So it's really important to get tested here at clinics just to make sure that everyone's being safe, because without those tests, we don't know if you have chlamydia or gonorrhea, and those diseases can lead to some really serious side effects. Okay, now the other half of unprotected sex is unplanned pregnancies. So you mentioned that you and your boyfriend use the withdrawal method?
Yes.
Okay, so something to note is that only 80% of the withdrawal method attempts are actually effective. So that other 20% isn't working. Another thing to note is that 1 in 5 couples actually who use the withdrawal method end up getting pregnant. So it's not really a strategy that we would suggest. We usually suggest the protection like female condoms, male condoms, IUDs, and other forms of birth control. Okay? Do you have any questions?
No, that sounds pretty straightforward too.
Okay,
It's a
perfect.
little nerve-wracking, but straightforward.
No, absolutely, and infographics like this can also help ease that anxiety, and just to know that we're always here too to provide some of these safe sex supplies, so you don't have to worry about struggling with buying condoms from drugstores and stuff like that, because it can get expensive. Okay, so we're going to move on to understanding contraceptives. What do you know already about contraceptives?
Well, kind of like what we just went over. I know about like the condoms and like birth control, and then I know, they stop stuff, and that's about it.
Absolutely. So something to note hugely with contraceptives is that there's many different types. So condoms are a contraceptive, however, they are only a barrier contraceptive, whereas birth control and IUDs are not a barrier contraceptive.
Okay.
So it does not protect against STIs and STDs. It only stops from the sperm entering into an egg and then turning into a baby.
Okay.
Okay? So something to note with that is that using protection is still really needed, and we definitely suggest using protection even if you are on a contraceptive like birth control. Have you ever thought about using birth control?
No, just like discussions with my girlfriend, so I haven't really thought of it much.
Yeah, for sure. And birth control comes in many different types and many different ways. So there's pills, there's patches, there's injections that you can get, I think, every 3 months, the Depo shot. And there's also a thing called an IUD. Do you know what an IUD is?
No, don't really know.
No? Okay, so it's called an intrauterine device. So what that means is that it's inserted into your uterus by a gynecologist, and then it sits there, and then it protects from things like getting pregnant.
Okay.
Okay? So let's go over some of the benefits. Some of the benefits of contraceptives is that regulation of menstrual cycles. So if you're noticing irregular cycles or really heavy flows during those cycles, something like a contraceptive can kind of even that out and help even that flow.
Mm-hmm.
Have you noticed a very heavy cycle at all?
No, not really. I don't really talk much about it, so I think I'm normal.
Okay, for sure. And birth control can still help with other things like menstrual cramps, and then of course unplanned pregnancies. Now they're not 100% effective, however we still suggest to use them because they're still a form of protection.
Okay.
Do you have any other questions about this?
No, that's pretty good.
Okay, alright. Well, why don't we move on to seeking help and support? So you mentioned that you don't always have condoms.
No, not
Okay.
always.
And those are expensive, and I know being a teenager, you don't always want to spend your money on that type of stuff. So we understand that. Now the nice thing is, like I mentioned before, you can actually get these for free here at the sexual health clinics. So things like the health clinic here, your actual school nurse at high school can help you with some of these things too.
Oh, okay.
So you can always ask her for advice. Another thing is online sexual resources. Now you want to be careful with some of those and make sure that they're actual good resources to use. So something we use is the Kingston Health Unit. If you look that up, they have a website with all sorts of things that you can look up, and it's all trusted resources.
Okay.
Okay. So for sexual health, we actually recommend going to the Kingston Sexual Health Resource Center, and that's just out on Stewart Street here in Kingston. Do you know whereabouts that is?
Yeah, I've got a pretty good idea.
Okay. It's actually near the General Hospital.
Okay.
Yeah, so it's a generalized area, and then we have their website and their phone number here, and then the hours that they have listed.
Okay.
Okay, and you can find condoms there as well. All right, so we'll move on. If you don't have any other questions, we'll move on to a teach back just to make sure, because I know you're under a lot of stress and anxiety, just to make sure that you have everything from what we learned today, okay?
Okay.
So could you tell me where you find condoms?
Well, you can buy them at stores, health clinics, sexual health clinics. I can reach out to like the resources in my school.
Right, perfect, awesome. Yep, that's absolutely correct. Do you know what the risk of unprotected sex is?
It could lead to pregnancy, or I could like pick up something like an STI. Or,
Absolutely. That one's good. And the difference of protection versus contraception?
well, one stops both, and then the other one just stops pregnancies.
Yeah, absolutely. So we're looking at the difference of STI, STD, and pregnancy, and then just pregnancy. So in order to stop that STI from getting through, we need something like condoms to stop that. And that's just a barrier method, so it helps keep a nice layer of protection around while you're having sex.
Okay.
Okay? Was there any other questions for me today, Kristen?
No, that was great.
Awesome. Okay, well, I want to thank you for coming in, and it was great talking.